Welcome back to another episode of the Audiocast with me, Dr. Shweta. I'm here today with one of my best friends, Dr. Shireen, an aesthetic physician here in Dubai as well. Shireen and I have known each other for many, many years now, and she's a dear friend of mine. And for the next episode, I thought I could bring her on here and we could share our thoughts on something new and more interesting.
Hi everyone, this is Dr. Shireen Hussain. I am an aesthetic physician here in Dubai. I'm practicing at sSkincare Clinic. And I'm so happy to be here. So when Shweta called me up a few days ago and she said, hey, do you want to be a part of this podcast? I was like, yes. I mean, it's so exciting and it was something new for both of us. So here I am and we're here to talk about something new and exciting.
We're here to talk about male beauty and all its perspective, both as doctors as well as women.
Yes, although that might be a bit biased.
It will definitely be biased. All right, so let's talk about male beauty. Like, where would you start off the topic with?
Okay, so male beauty, I think now there's a lot more men who want to look good, who want to look their best. So there's no taboo to it anymore.
Right.
Like a few years back, even for a man to get a facial or like a manicure or something would have been a really big deal. And it would have been something that, you know, I know a lot of people would have totally judged them for doing it.
Absolutely.
But nowadays, like doing aesthetic treatments, whether it's lasers or Botox or fillers, there's so much more acceptance to it.
Yeah.
And it's not just only in the Western world, but also in the Arab world. And of course, in the South Asian world, there is so many more men now walking through the doors.
And you know, this is very interesting because much earlier in my practice, we had to butcher up words like man talks and bro talks.
Yes.
For a man to be able to do it. And the number one fear of most men walking through the door is, well, my friends find out, am I going to look more feminine at the end of this?
Yeah.
And I don't hear those questions anymore. We don't have to butch up and say bro talks. You're getting bro talks. It's just regular stuff.
Absolutely. And there is so many patients that we have, like the wives or the girlfriends will come in with their partners and they will be like, hey, you know, I want this done for my partner too. So, and once, you know, men generally see their partners getting things done and they like it, they want it too. So it's all about, I think, the whole self-care, self-love. You want to look and feel your best.
Yes. And I think we've got to thank social media for a lot of that, because most people especially look up to certain role models. And for men, that could be footballers, like we were talking earlier, how Wayne Rooney made hair transplants really in vogue.
Yeah.
Because he went out with a hair transplant and, you know, with finasteride, he was very out and open in public about it. And a lot of men started looking and saying, wait, that hair isn't real. Okay, so if he can do it, why can't I do it?
Yeah.
And so a lot of our idols do these things and they look great. And you start wondering, why doesn't George Clooney really look his age?
Yeah.
And you want to do the same thing.
There's something definitely going on there, right? Like he has a really good dermatologist.
He cannot look that good. It's not olive oil.
No, it's not.
All right. So let's talk a little bit about what an ideal male or the actual standards of beauty for a male. Like, what are we conventionally taught?
Okay, so conventionally, see, it's all about the golden angles of the face, right? So men and women have completely different angles of the face, whether it's the cheekbones or the length or every single part of the face is different for men and women. For men, we usually see a wider forehead. We see a wider jawline. Instead of compared to women who have a more pointed chin, men have a wider chin. And of course, the eyebrows, the female brow, the more arched it is, the more beauty it has.
Right.
But for men, it's all about the low set brows without the arch. So these are some of the features that differentiate men and women in terms of the beauty standards. And it's important for physicians to know so that when you're treating it, you know exactly what to address.
We were talking about this earlier. This is an interesting point for me. Gender morphing as well as racial morphing.
Yeah.
A lot of women, remember when Texas jawline got very famous and women wanted Angelina Jolie's jawline.
Yes.
You just understand that's a masculine jawline on a feminine face and not everyone can pull that off.
No, not at all.
Similarly, there are so many South Asian men who have feminine features as well. It sits really well. And
yes.
So we see a lot of swapping right now of features. So there's no black and white anymore, which I really like.
Yeah.
It's so it's so constantly changing, which is really nice. But 3 ideals of beauty that we've learned, at least in school back then, was square for men was always squarish. And that brooding, mysterious eyebrow look, which most men like and women don't.
I like it.
Oh, you like it?
Yeah.
You like
on men, right?
Okay, perfect. So what are the procedures let's talk about procedures. What are the common procedures you do for men?
So before I actually came here, and I know I was really late, so sorry about that, but I did actually do a little bit of research on what are the common procedures that we see men doing.
Right.
So according to like the articles, the first one is for a receding hairline. The second one is for the tear trough, so the under eye look. People come in saying, I'm looking tired, so that's the second one. And the third one is, of course, the jawline, the chin. So this is according to like, a worldwide survey, like what are the top 3 procedures that men get done with their dermatologist. In my practice personally, I do have a lot of patients coming saying, I'm looking so tired. I wake up and I'm not fresh anymore. And of course, then we target their tear trough area if they're a candidate for that. And of course, in Dubai, because everyone, likes beards a lot, especially like the Asian, the Middle Eastern men, we do have a lot of patients coming in we want a more pronounced jawline. We want a more pronounced chin. So these are the 2 most common ones that I see in my practice.
Oh, that's interesting.
But what about you?
I do a lot of skin quality, you know that. So I've seen a lot of men, it's very, we were talking about this as well, how men are much luckier when they age.
Yes,
They just age like fine wine. They just get better, which is a bit unfair, but they tend to look much better as they grow old. That salt and pepper look really works.
Right.
But they do worry about their jawline quite a lot. So I got a lot of men coming in for jawline, but I work on their skin quality because you can do a lot of injectables for skin quality, but some energy-based devices, because men are usually worried about how often they have to come in for these procedures. They don't want high maintenance procedures.
No, they don't.
And they are worried about pain.
Yes, much more than women.
Much more than women. So a lot of men mostly ask about pain. How painful is it? What can I do about the pain afterwards?
Yes.
So that's the reason why I think energy-based devices work great for men.
So do you think it's more like a holistic approach that, it's all like combined? Like, of course, you have to concentrate on the skin quality as well.
100%. I think that's where I say less is more. Because when you combine energy-based devices with a little bit of injectable, that's the cherry on top of the cake.
Yes.
That takes away, and they look fresher, they look better. And they're not worried about feminizing their face, which is another fear they have.
Tell me about, how many treatments do you do for the receding hairline? So is that something you see commonly?
Actually, not as much as before, because people are tending to switch a bit more to hair transplants, much more than before now.
Right.
Because the downtime's come down, the social acceptance is increased. But we do a lot of PRP, exosomes, mesotherapy for hairlines. Not as much as before, I've got to be honest about that.
Yeah, I agree with that too. I think the trend is slowly shifting to getting something more permanent. And people don't want to come in and kind of invest the kind of money and time. Like if you have to do something every month for a few months before you see a difference, I'm also seeing a lot of that nowadays.
And I think that switch came after COVID, because when we had that time to have the downtime and to work from home and to do all your Zoom calls from home, people took that time and advantage to get these hair transplant procedures outside.
Right.
So they could maintain it later with their PRP or exosomes.
Yes.
That is a good switch, I think, because it's a bit more feasible long term.
Oh, yeah. Okay, so I found something really interesting in my research. You want to hear this?
Yeah, absolutely.
Okay. Studies have shown that men with receding hairlines are perceived to be on average around 5 years older than they actually are.
Okay, interesting. That's nice.
Yeah. But I mean, some men can pull it off, right?
Some can really, really pull it off. Yeah.
And now listen to this. To keep the punishment coming, men do not produce as much endogenous cutaneous antioxidants as much as women do. So they have a different response to UV light.
Okay, so we got lucky there.
We got really lucky there.
Cool. So the take-home message from this audiocast is that there's no black and white when it comes to beauty. We've realized that already.
Absolutely.
Similarly, with gender, when you try to beautify a particular gender, like I said earlier, there are women who want strong jawlines and there are men who want high cheekbones. So I think the important thing is finding a practitioner who's able to understand this, and this we cannot embellish enough. Is that to find someone who really knows what you're looking for like we discussed, Sylvester Stallone has pointy eyebrows and
Yes.
he loves it.
Yes.
Another interesting point is how we change our consultation style depending on whether it's a male or female patient. For example, there's a beautiful study that really showcases the difference between how a practitioner changes the consultation style between a woman and a man. Like, for example, a woman comes with all her options. She knows exactly what are the different options
Yes.
for her thing.
More than us sometimes.
More, absolutely.
Yes.
And speaking as consumers, even we've done this.
Yeah.
We've researched all the options, gone through all the reviews. And so we just want the doctor to show us, okay, this is what you're going to get done. Whereas a man is a bit more objectively open-minded, let's say, and lesser reference points. So even the way they sit across the patient is different. For example, practitioners sat across a woman while consulting, whereas with a man, they were sitting beside them, side to side, sort of working as a group project, because a man's a bit more...
That's so awesome. Yeah.
Yeah, this is a very well-known study. And it's nice because at that point during the consultation, there were 3 fears that men conveyed.
Yeah.
A, which is feminizing the face. B, which is how often do I have to come to maintain the results? And C, how painful is this going to be?
So what's your take-home message, Shweta?
My take-home message is simple. Like we always discuss, beauty is not black and white. And so should be your treatment choices as well. If you want to have high cheekbones as a man, go for it. Because there are women who have stronger jawlines as well as wider chins. So again, there's no black and white rule.
Yes.
So it's important to discuss it with your practitioner.
Yes.
And tell them this is what I want and this is what I think would look great for me.
Yes, for sure. So I think for me is, first of all, yes. So there's no taboo in men coming in to get cosmetic or aesthetic procedures done anymore. Everyone wants to look their best. And the second thing is, yes, choosing a physician who understands male and female beauty and who can deliver what you want and what you're looking for.
Yeah, that sounds about right.
Yeah.
I want to always finish with a rapid fire.
Okay.
This is how we wrap things up here.
Okay.
All right, so for my first question.
Should I get ready?
Yes, you should.
Yes.
So for my Dr. Shireen, what alternate career path would you have chosen if you were not doing what you're doing now?
Okay. I would either be an architect or a homemaker.
Oh, okay, brilliant.
Yeah.
I knew this. All right, for question 2, what one lesson has your job or your career taught you that you think everyone should know at this point in life?
Finding Nemo, the fish Dory, she just keeps saying, just keep swimming. I think that's, just keep swimming, like just keep going at it and you'll get where you need to be.
All right, so for the last question, what was the last thing you Googled?
It was about where to find biryani in Jumeirah.
That brings us to the end of the show. Thank you so much for coming, Dr. Shireen.
Thank you so much, Dr. Shweta, for having me here. I'm so honored to be a part of this show and I can't wait to be back.
So we'll be back soon next week with another colleague, another topic. And if you have any suggestions on what you'd like for us to discuss, please drop a comment. Till then, please like, share and subscribe to my YouTube channel and I'll see you soon.